Hi, this is Cheryl, Vidu, and Esthella.
Hi.
Vidu's on the phone, but good evening. Tonight we'll discuss nursing as a leader from our Nursing 344 class. Our study today is about quality assessment and improvement in nursing care. Our sample case study is about a nurse practitioner working in a medical facility who had a claim filed against her and several others for alleged failure to obtain proper medical history. Improper medical clearance, improper management of anticoagulant medication, failure to communicate with the referring surgeon, failure to properly document clinical findings, failure to provide proper patient instructions for preoperative management of Coumadin. The failure to order an appropriate Coumadin substitute and legal expenses for this claim, cost of $166,696, was spent to settle a case that never should have started. The patient was a 45-year-old woman with a history of cardiac disease, which included mitral valve replacement.
That's okay. That's okay. The patient was a 45-year-old woman with a history of cardiac disease, which included mitral valve replacement, aortic valve replacement, and prior cerebral vascular accident and atrial fibrillation. She was receiving Coumadin for anticoagulant therapy because this patient was a high risk for producing blood clots. She was seen by her gynecologist for complaints of increasing pelvic pain and diagnosed with enlarged uterine myoma. She required a biopsy, and if the biopsy was benign, she would undergo a bilateral uterine artery embolization. The gynecologist ordered medical cardiac clearance for surgery. The nurse practitioner cleared the patient without understanding the nature of the procedure and provided the patient with a handwritten note to stop her Coumadin 4 days prior to the procedure. The nurse practitioner claimed she meant only the biopsy, but the patient misunderstood these directions and stopped her Coumadin medication prior to her surgery instead. It was disputed that the patient informed her surgeon that she had stopped the Coumadin, but the surgical physician did not order any replacement therapy for the Coumadin prior to the surgery and after the surgery as well. The patient resumed her Coumadin therapy after discharge and shortly after suffered an embolic stroke and cerebral infarct.
The main problem here was communication. The nurse practitioner should have consulted the surgeon as to what she was to clear on this specific patient. To do an accurate clearance, she needed to know the exact history of the patient. And by doing that, she would have looked in the chart and got the history. She would have contacted the surgeon to ask him what specifically he needed to have clear so that no problems of communication would have resulted. By not doing this young lady suffered a stroke. And by suffering this stroke, it was because of communication failure. As risk managers today, we need to improve quality care and put our focus on the patient and providing risk management. Risk management involves all departments of an organization. The risk management program includes identifying the risks for accidents, injury, or financial losses. The required formal communication among all departments to identify problem areas and review factual data related to risk management control and the planned intervention strategies to predict outcome. Now, with all of this said, if we communicate with each other, from the doctor to the nurse practitioner to the scrub nurses in the surgery, someone there should have been an advocate for that patient and realized Coumadin wasn't done. The day of the procedure, when the anesthesiologist came to see the patient, the question should have been answered again right there. No steps were shown that any of these were done the day of surgery. So the nurse practitioner, yes, she was wrong, but it was wrong because on an ordinary stance, the anesthesiologist will come and see the patient and ask what medications that she's taking. She could have provided that note at that time or told that nothing was given to her. So in order to have quality communication, we believe that we have to put it in progress. So we have to check, and double check to make sure our patients are safe.
And please please use the S bar. The S bar is a very effective communication tool that prevents medical errors at all times. I'm a big advocate for S bars, and please use them.
Thank you.
Thank you.
Good night.
Good night.